All right, let's jump right in. Today, we're taking a look back at 2025, and believe me, it was a year that totally changed the game for women's health. So let me ask you something. What if you could get life-changing relief from a medical device that's actually smaller than a pill?
And what if we could go even further? I mean, what if doctors could tap into your body's own power to heal itself from the inside out?
Look, this might sound like something out of a sci-fi movie, but in 2025, this stopped being fiction. It became the new reality in women's health. Okay, let's dive into this.
All right, so before we get into all the cool tech, we really need to understand the why. What's the problem we're trying to solve here? Well, it's a huge one, a common struggle that so many women face, often completely in silence.
And when I say huge, I mean it. We're not talking about a handful of people here. We're talking about hundreds of millions of women all over the world. Their daily lives, their quality of life is seriously impacted by these disorders. It's a massive, massive issue. So what exactly are we talking about when we say pelvic floor disorders, or PFDs? Well, think of it like this. There's a sort of hammock of muscles down there that supports all your pelvic organs. When that hammock gets weak, things start to go wrong. It can lead to all sorts of really challenging issues, like incontinence or even organ prolapse. It can make just getting through the day a real struggle.
Okay, so now that we know the problem, let's get to the solutions. And this first one is incredible. We're entering a whole new era of nerve stimulation, where tiny tech is providing some seriously big relief.
Now, this is where things get really interesting. Take a look at these two devices, both FDA approved in 2025. You've got Nuspera's ISMM system. The big deal here is it's battery-free. And then you have Medtronic's AltaViva, which is this tiny, fully implantable capsule. I mean, both of these are absolute game changers for treating urge urinary incontinence. Let's break that down a bit. The ISMM system, think of it like wirelessly charging your body for just a couple of hours a day. The best part? It completely gets rid of the need for more surgeries down the line to replace a battery. That's huge. The AltaViva, on the other hand, is all about patient control. It's a teeny tiny implant that you can activate yourself whenever you need it. Super convenient. All right, moving on from tech to, well, a bit of a bombshell, actually. A huge study came out in The Lancet that really shook things up. It basically challenged a medical belief that's been around for ages. This is where science went head-to-head with the status quo. It really makes you ask a fundamental question, right? We always think more tests, more data, that has to be better for the patient. But is it? Is it always the case? The Future study decided to put that exact question to the test. And the results were pretty shocking. Here's the key takeaway. For a lot of women, adding this invasive, often uncomfortable test, it's called a urodynamic study, it didn't actually make their treatment any more successful. A good, thorough clinical checkup was just as effective. Just think about that. This finding could spare millions of women from a procedure they just don't need. Okay, so far we've talked about managing symptoms. But what if we could do more? What if we could actually repair the damage? Well, that's where we're headed next, into the super exciting world of regenerative medicine, which is finally moving from theory into real clinical practice. And in 2025, we saw progress on so many fronts. You have things like PRP injections, which basically use the healing power from your own blood. Then there are these biological patches. They're called ECM scaffolds that reinforce tissue. And we're even seeing the early days of stem cell therapies and vaginal lasers. The big idea behind all of this is to stop just patching the problem and start fixing the root cause of the tissue damage itself. You knew it was coming, right? We can't talk about 2025 without talking about AI. And this isn't some far-off futuristic idea anymore. AI is becoming a real practical tool that's right there in the clinic, helping doctors every single day. And this slide just lays it out so clearly. First, you've got smarter diagnosis. AI can analyze medical scans, like ultrasounds, way faster and often more accurately than a human can. Then, during surgery, it's like a real-time GPS for the surgeon, helping them navigate and avoid critical areas. But maybe the most exciting part is creating personalized plans. AI can crunch all the data to predict what treatment will work best for each individual patient. We're finally moving past that one-size-fits-all approach to medicine. Okay, for our last big breakthrough, it's not a new gadget or a fancy surgery. It's something just as important, a new rulebook. In 2025, we got the first ever comprehensive clinical guideline for a really common condition related to menopause.
And this was a huge milestone for something called genitourinary syndrome of menopause, or GSM. For the very first time, doctors now have a clear, science-backed roadmap. It sets the standard for how to diagnose it, and it confirms that low-dose topical estrogen is the safe and effective way to go for first-line treatment. This gives them a clear path to help the millions of women who deal with the symptoms.
So when you pull back and look at 2025, you start to see these big themes emerge. And the first one is this: the future is more minimally invasive. It's all about doing less to get better results. Smaller implants, fewer tests.
The future is also more intelligent. We're using AI and data to make smarter, more informed decisions at every single step.
And maybe most importantly, the future is more personalized. It's finally moving away from treating everyone the same and is now about tailoring medicine to the individual. It's about getting the right therapy to the right patient at exactly the right time. Think about it. All of this happened in just 1 year. It really leaves you with a powerful question, doesn't it? If this is what 2025 looked like, just imagine what the next decade is going to bring. Thanks for joining me for this explainer.